Okay, great. So, hello everyone. Good morning and good evening. My name is Priyanka Singh Bais, Marketing Director of PMOGA India Hub, and I welcome you all to another exciting episode of PMO Insight series brought to you by PMOGA India Hub, the esteemed local community of PMO Global Alliance in India. We are thrilled to present a thought provoking panel discussion today, featuring esteemed global experts in project management and PMOs from the industry and academia. Today's panel discussion is supported by PMOGA Healthcare Strategic Community, focusing on the critical topic at hand and actively promoted by PMI San Diego chapter. It is our honor to have the highly knowledgeable and experienced Asiya Sheikh as our moderator for this engaging session. So, without further ado, let's delve into the captivating insights and discussions as we pass the baton to Asiya Sheikh. Over to you, Asiya.
Thank you, Priyanka, for the great introduction. Hello, everyone. Good morning, good evening, good afternoon, wherever you are. Thank you for joining us today. In today's panel discussion, we'll be talking about the insights of how the pandemic brought challenges to the healthcare workforce and what responsibility or role can project managers take to tackle such natural disasters in the future. We decided to ask our audience two questions and hear their thoughts on the impact of COVID-19. Let me share my screen with you to share the questions that we asked them so you may see the results that we received or the responses that we got. I hope my screen is visible to the audience. So our first question that we asked was, what, in your opinion, has been the most positive outcome of COVID-19 in healthcare? Surprisingly, we did receive a tie between telehealth and less travel, which was 31%. The next, the most responses were work and family time harmony. So they enjoyed spending time with family at home, and health tech adoption was the least response that we received. Our second question was, what is the most significant global project management change that stemmed from COVID-19? So the most significant change that we received was remote project management, working from home, and followed by focusing on risk management. Then our least responses that we received were on focusing on upskilling and AI-enabled project management. So these were the responses that we received from our followers on LinkedIn. So before I ask the panelists to introduce themselves, I'd just like to go over the housekeeping. You may type your questions in the chat window and we will answer towards the end of the discussion. If we're unable to answer your questions, we will get to you via email, so please do leave your emails. Now I'm going to turn over to our panelists and I'd like them to introduce themselves. Let's start off with Dr. Deepa.
Hello. Good morning, good afternoon, and good evening. My name is Dr. Deepa Bhide. I'm based out of Hyderabad, India, a southern state close to Bangalore, if that is a little more familiar to you. I'm a pediatrician and I'm also a project manager working closely on the blend of project management along with healthcare. And I'm very happy and honored to be a part of this panel discussion along with my colleagues and Asiya. Thank you.
Thank you, Dr. Deepa. I'd like to call upon Miki, our next panelist.
Thank you, Asiya. Good afternoon, good morning, everyone. My name is Miki Nakamura. I'm based out of the U.S., western part of the U.S., and I've been working in PMOs and healthcare, as well as the industry for a good portion of the past 15 years. Really, at this point, building and standing up multiple PMOs in different industries. And I'm really excited to be here to talk about the uniqueness of healthcare PMOs and how I can enable patient-centered care. Thank you so much.
Thank you, Miki. Our final panelist, Michael.
Good morning, good afternoon, good evening, everyone. Thank you for being here. So my name is Michael O'Connor. I'm with Medtronic, and I'm a Senior Research Program Director working with spine robotics. I've been in the medical device field probably going towards 40 years, and been in the project management field for about 30 years. And I put EPMOs, PMOs, and all types of different things into place. And looking forward to this conversation and to what the other panelists have to say, and glad to be a part of this panel discussion.
All right, let's get started. So it seems like, Dr. Deepa, I'd like to start off with you first. Being a physician and you've also worked in the project management you've also worked in project management, and coming from a medical background, you must have witnessed both sides of challenges, from patient lives to management during the pandemic. What were the top 3 challenges you faced as a physician during COVID?
That's a very good question, and thank you for that, Asiya. I think that also gets us started on this panel discussion, right, with what challenges are faced by the healthcare as professionals, as well as physicians and other healthcare professionals. So thank you for that. I think healthcare normally a sort of not so busy in terms of the deluge of any issues, but normally a domain which suddenly was thrown into the forefront because of the COVID-19 pandemic. And because of the sheer amount of the number of cases, the complexity of the diagnosis, the treatment, the novelty of the treatment, not that pandemics are unknown to the human community, but this pandemic was different, and the pandemic really threw the whole world out of gear, and healthcare as a domain was left right in the forefront, and people are looking to healthcare. I think few challenges that were faced globally. It's not like only one part of the world faced. Although I would say complexity, or there were some variants around these challenges, which differed with a community or a country or a part of the globe or whichever that is. But the challenges were faced across the globe. I would say few challenges. The first, I think, the topmost challenge as a healthcare professional, and actually we all were a part of it. So we actually had to go to the hospitals and be a part of that scene. It was quite a overwhelming scene actually to be. The first challenge was just the sheer number of patients, doctors, physicians, all the healthcare workers faced a lot of increase in workload. There were a lot of mental stress, agony, and sometimes also just 24 hours, 36 hours without even taking rest. I think that was the most important challenge for the healthcare workers and physicians. And how do you really stand to that level of physical and mental stress? Even as a healthcare community, we are all human beings, and to see that psychological stress and physical stress, it was quite a taxing phenomenon. The second one was the healthcare community themselves were also at a risk of infection, so they were actually risking their own lives, and there was also some level of social stigma associated with those healthcare workers who were working on the fields, because they were supposed to be carriers of the infection. So not only were they facing this risk of infection, but there was also a some level of social stigmatization. Although I would say the community was largely favorable, very appreciative, but still that was there. The third, I would say, is a lack of clinical leadership. And by that, what I mean is that generally, whenever there is a scene, or there are a group or a constellations of symptoms or signs which don't seem to be falling in a natural pattern of the disease, the clinical leadership, like we fall back on some of our resources, such as the Lancet or the JAMA or British medical journals or our own fraternity, and we do get some level of decision support. So how do we make the decision to treat the patients? In this case, there was a very little clinical leadership because everybody was struggling. So
Yeah.
people in Japan were struggling, from the US they were struggling, and this actually created a need of having a constellation or a consortium of group of people who could come together. And by this, it could be diagnostic people in the diagnostic industry, therapeutic industry, medical devices, people in the management, public health infrastructure, and many other domains who should be coming together and helping the physicians take care of this. So I think this were the topmost challenges, and it also created a need of a consortium to be formed and really managed and helped.
You've put it so right, and like you said that these challenges were faced globally. Um, yeah, there was a lot of stress on how the healthcare workforce, the healthcare staff as well, everywhere. Lack of sleep, lack of rest. But yeah, although we've just listed down all the negatives, but I'd like to ask you, were there any positive outcomes from the COVID-19?
Oh yeah, actually, quite, and some were quite surprising. Like we saw in the poll, people suddenly got to see a balance between their family and the work. Less travel, we saw cleaner cities, few cars, blue skies,
That's
lifestyle
true.
suddenly changed, and I think people also lowered their very risky behaviors. So that was a good outcome. People got some time to actually take care of their chronic diseases, and they actually monitored their blood sugars and BPs and all much better. They also had a good dialogue, and telemedicine actually came to be at a rescue. So they actually had a good dialogue with us and said that, I never actually, probably never had time to speak to us, but this is a good time we are able to speak to each other. But I think there were a couple of other more key positives were people have, I mean, the healthcare built in some way, healthcare had developed a resiliency, and the resilience that the healthcare as a domain stood, it would, we could see the stretch that was there on the domain, but still the domain was able to stand for themselves. So that was one. Two was a reassurance in this entire public health setup that it is going to stand the test of time. That was the second. And third is the just the partnerships that developed. Everybody came to start to the social media, the communication, and the different NGOs, that is, the non-governmental organizations, the academia, the project management organizations, and PMOs, and everybody started to think in a very strategic way. And I think that really came as a very positive outcome of COVID-19, that there was a group that started getting formed. And I personally feel that was really a need, and that was the birth of a PMO, a strategic PMO for healthcare. And then it moved forward, probably uh, laid a foundation for a lot of business transformations, a lot of financial transformations, clinical transformations, and of course innovations.
True. I completely agree with you. Innovations and a lot of transformation started from COVID-19. Yeah, that's true. Thank you, Dr. Deepa. I guess I'm going to move on to our second panelist, Mickey. Mickey, you've been in a leadership role for over 20 years in various sectors, having diverse experience with PMO, IT, healthcare, and the list goes on. And you've also been a 2022 PMO Global Award winner. I would like to ask you, having all that diverse experience, I'd like to ask, how can PMOs leverage their experience to drive innovation and business growth post pandemic? Because I know you've also worked in innovation as well.
Thank you for the question. I think what we learned from the pandemic, and especially after hearing, I think Dr. Deepa wrapped it up or provided some really good highlights out of the experience, is that PMOs, whether you have a PMO formally or not, and they're called many different things in many organizations, it really focused on bringing people together and having in place a way of making decisions. And during COVID-19, we learned that decisions were critical, right? Making quick decisions, being agile with the discussion, and having a means of bringing different arms of an organization together, and especially in healthcare, to provide patient care, to enable our physicians, enable caregivers, etc. So with PMOs being already in existence for a number of decades. I think what the pandemic proved is that PMOs could be seen in a different light. PMOs could really be utilized to help to just galvanize and make quick decisions to help support patients. And some of the things that we all do formally in PMOs, they were accelerated, right? The concept of having agile and quick governance,
Right.
for example, right? Bringing together decisions that were creative, having new ways of working, working in a different way, digital medicine, telehealth. And I think it was proven that these things outlive the pandemic. These things that we do in PMOs are being utilized today. And there's a lot of innovations during that time that are being used today for other transformations, like Dr. Deepa said, right, with business transformation, clinical, and digital at the same time.
Right. You're right. I mean, yes, it did bring a lot of transformations with the help of COVID. Now, what I'd also like to ask, what were some of the lessons or the best practices that you have seen that has come from this pandemic regarding PMOs?
Well, I think I mentioned
this would be a follow-up question too.
Yeah, I mentioned a number of things. One of the things that has really it would be a practice that we use today is a lot of PMOs, at least the PMOs in the past, were focused on projects. The PMOs that we're talking about today that are, especially in healthcare, are
more agile,
much more strategic. And they're also focused on people, right? So you're bringing in different types of frameworks, but at the end of the day, it's bringing together people. And there's a focus on much less projects, but more of a focus on change adoption, embracing change, embracing all of the disruption that is constant, right? Every other day, there's a new innovation, there's AI, there's ChatGPT, there's different clinical initiatives that are not necessarily projects, right? In fact, many of the clinical initiatives in healthcare are more operational, or they're more along the lines of improving workflows, looking at different ways of improving compliance, for example, in healthcare. And much less, there's also different types of they're not just products, right? But they're services that are being provided. And with this said, healthcare really does require focus on organizational change. Having a change strategy, having a design around change, and then having a transition around change to help enable the clinical leaders as well as the business. And you want these changes to take root. You don't want them to just be done. You have a go live and you move on. You need to actually make these changes real. And you do that not through project management necessarily, but you do that by bringing people together and having a strategy. Let's say using a persona type of change where you're looking at physician groups and nursing groups, and then you're focusing on the patient impact and the patient experience. So this is one of the things that really caught on during the pandemic, because of course we were all impacted by the different disruption and changes. And we come out of it, I think, much more nimble. We come out of it much more focused on using this, not just in healthcare, but using it in other industries.
That's true. The organization change management that you pointed is very beneficial. Is very true about. You mentioned AI chat GPT, but I think I'm gonna shift over to Michael now and ask him about the AI and chat GPT. So Michael, you've had over 20 plus years of experience as well. What impact has AI or chat GPT made towards project management?
Yeah, so thank you for the question. In my mind, AI and ChatGPT are still in the infancy stages, but I do think they're making strides with being able to create project plans, monitor those plans, monitor resources, those type of things. But I will tell you, in healthcare, especially in medical device where I'm in, a very regulated industry, AI and ChatGPT are being looked at. In a way that we're going to adopt it, but we're going to be slow to adopt it because we're always slow to adopt everything, and that's a good thing for patients, right? So it's useful, and I think I've heard people say that AI and Chat GPT are going to take over project management, and there's not going to be any project managers. Well, I don't think that's true in my opinion. I think it's going to enhance what you do. But as project managers, we're really problem solvers. So anything we can bring in to help us get data and problem solve, like AI and Chat GPT, will be really good. I can tell you, I teach at many universities, and Chat GPT is an issue there, right? Because students are figuring out how to utilize that. And as instructors, I have to figure out how to combat that so that they don't just get everything through Chat GPT. So it's evolving quickly. And I think the project management, people will embrace it. But for me, it's still pretty early. I've listened to people like Ricardo and Antonio talking about AI and project management. I mean, it's here and it's coming, but I think it's in a way that it's going to enhance what we do, but it's not going to take over what we do. And some of the positive things I see is it's going to eliminate some of the tasks that we do. That I don't know about everybody, but I keep dashboards and I report out to senior leadership. So hopefully it's going to reduce some of those mundane tasks, and it's going to be a way to wrap that up into things I can see quickly, and I don't have to manually type anything in. And I think it's also going to reduce cost in a way that we're going to see things quickly and easily. And through the Chat GPT, those can work 24/7. I don't need people to be doing those kind of things day to day. Some of the negative things, though, is that it may reduce those early career opportunities. So as we get into more AI, the sophistication of AI and Chat GPT, it may, make getting those early project management roles less and less. So, the rudimentary stuff, I think, is what it's set up for. And so those career opportunities might change. And I think some of the templates and canned reports, this is perfect for AI and Chat GPT. So that type of work, again, maybe that earlier or junior project manager, that may not be as easy anymore. And then I think just the whole thing about AI and how it's going to contribute value. There are going to be certain tasks that just go away. And I think a lot around resources. I think AI is really set up to help resources. And I know for myself, I have technology, but we seem to always divert back to Excel. And I'm looking forward to AI helping me manage resources and really get a clear picture of what that looks like. But the other thing I would say too for project managers with AI and Chat GPT is don't wait to learn about it. I actually went on LinkedIn and I took some learning courses there just so I could get more information and learn more. I think you have to, like anything, you have to embrace this and you have to go out and teach yourself and find courses and find things. So LinkedIn is one good resource. I haven't found any others at the moment, but I have taken 2 courses there, and they were quite insightful by very good instructors. Well done. So I think that's a big thing is don't sit back and wait for this to happen. Get involved and figure it out. And I think typically in healthcare, like I said, where I'm at in medical devices, to really embrace this is going to take time because we just don't embrace new technology quickly and for the right reasons, right? So we're going to do more and more with it, but it's going to take longer and longer, and other industries will pave the way, and we'll see how they do that, and we'll learn from them, and then we'll also educate ourselves the best we can.
That's good. I mean, it's good that you mentioned about the courses on LinkedIn. It'll be useful if you can share the links with our audience so that if anyone's interested, they may go ahead and register themselves for those courses. So my last question to all of you would be, like, what are the key takeaways from this discussion? So I'd start off with Dr. Deepa.
Thanks, Asiya. Before talking about the takeaways, I wanted to offer a little bit of comments on what Michael said about AI and ChatGPT. And he has put it in such absolutely correct words and appropriate, the thinking line, the way ChatGPT and AI is taking over things and taking over project management. In healthcare, the way I look at it is, as a physician and as somebody who is working on, I mean, as a project manager working on healthcare projects, the healthcare projects are and will continue to be patient centric projects. So, although AI may or chat GPT may help in some of, like Michael said, some of the very basic transactional tasks, for example, creating a clinical note. I would say thousands and thousands of notes, maybe the chat GPT really helps. But when it comes to clinical decision support, is largely a clinical function. And I don't think that will be taken over by any of the AI engines.
Yeah.
For example, we already have a lot of expert systems that we call in clinical medicine, and we do take care help of expert systems. For example, they throw up about 4 to 5 diagnoses for us and say that given these constellation of symptoms, do you have? I think you are looking at pneumonia. This, that, 1, 2, 3. But really, when we are looking at the patient and we are going to actually treat the patient, we are not looking at 4 treatments. We have to use our own expertise and experience and then actually zero on one diagnosis and then take that line as a plan. So I would say that chat GPT, AI, or any health informatics for that matter, any technology really is an enabler for the healthcare workers, really is the enabler. But they can never ever replace a doctor. They can never ever
Sure.
replace a healthcare worker.
Yeah, they
So
can't replace humans. Yeah.
they cannot. Uh, and also, like we know, medicine is not 2 plus 2 is equal to 4. So no amount of algorithms is going to fix and say, oh, you have cough plus cold, which means you have this. Cough plus cold could be
Yeah.
anything from a simple cold to COVID-19. But anyway, that was just thought would add to what Michael said. And I think my key takeaways is actually the creating and understanding and appreciating the need of strategic PMOs by healthcare domain itself. And by that is that particular key takeaway is where we must understand that it's not something that every healthcare facility or every particular community can take care of all the patients all by themselves. They definitely need a help of an IT, they need a help of an NGO, they need help of a multiple stakeholders. And I do feel by strategic PMOs who are aligned with the vision and mission of the healthcare facility, of the people who work in that. And they actually tightly work with the healthcare team to ensure that there is a quality outcome. And that is what we say the Institute of Medicine has given 6 quality outcomes for a patient care. And I would say that the strategic PMOs should work with the healthcare, and healthcare should work with strategic PMOs
Correct.
uh,
Yeah.
for the the
We
quality
need to
care of the patient.
synergize. Yes. Yes.
That would be my take.
Um, yeah. Yeah. Mickey, what is your key takeaway from this? I know.
Well, what Dr. Deepa said, I think is true, and I think that's where the focus in healthcare, it's patient-centered, people-centered. And one of the things, speaking of lessons learned that we can utilize in healthcare is, connecting the dots early up front and having a intentional design around the patients, and then having that unify the leaders, the clinical caregivers, frontline staff. I think that's what PMOs do in general, but this is where healthcare is very defined, it's very disciplined, and embracing all of the different views in a typical healthcare organization, whether it's acute or ambulatory. I think this is one of the things that we've learned is that bringing folks together. And then now you can focus on having folks go in the same direction with regards to these initiatives like AI, for example. And it's not just AI, it's also other initiatives that you have with telemedicine, telehealth, EHRs, EMRs. I think one of the things that we can learn is, does the organization have capacity to take on new initiatives, right? And so this is something that that can be said for AI and ChatGPT as well, right? Can the organization absorb this? And to Michael's point earlier, embrace it, learn about it, right? And This is where you have a framework in place to look at things very quickly and have an open mind and be very objective. And this is where you can embrace new technologies and new ways of working. So I think it's really well said. Don't just focus.
You mentioned that. Sorry. Go ahead.
No, go ahead.
Okay. I mean, it's good you mentioned that because, even the organization that I work for is also studying on the adaptation of AI and ChatGPT within healthcare. So, yeah, I mean, I think I would think that organizations need to adapt AI and ChatGPT because if not, then, they'll be left behind compared to other organizations. I mean, this is just my opinion.
Absolutely. And having a very tight way of looking at what is the pros and cons, working with physician provider groups and working with clinicians. And I think one of the things that folks in the PMO do really well is once we're able to put together and listen and then put together some thought on the strategy and design, then we're able to put in some very tangible tactical roadmaps, right? And these roadmaps help advance the organization. So, this is really, really, I think, positive, right, coming out of the pandemic.
Right. Michael, what would your key takeaway be?
Yeah, thank you. So as people have said, COVID was a tough time, but it was also a huge learning experience for all of us. And thank goodness for having PMOs and project managers. At Medtronic, we were able to pivot very quickly. I was in corporate technology and innovation at the time. And, having those people in place and project plans and whatnot, we were able to do an innovation challenge, and we were making a sub $1,000 ventilator at the University of Minnesota and our competitors. Who would have ever thought that would happen? In the meantime, in Galway, Ireland, we were trying to take our production 5 times for our ventilators, and we did do that. So we had a lot of different things. I even remember a meeting with the head of 3M when this kind of all unfolded in March of 2020, and they had to go back and work on masks. We had to go back and work on our PPEs. So having those PMOs and having project managers in place and already having that structure was huge to the success of what we could do to help patients. That was really our only goal, is to help patients and increase ventilators as much as we could. So that's my first point. And then the second point is really, clear and crisp, is AI and ChatGPT aren't going to replace project managers, but they're going to enhance what we do as a living. And I think other panelists have talked about it too, but do go learn, and I'll try to find that link. But I think embracing that and trying to figure out what your role is and know about it is only going to help you versus be a hindrance.
Okay. With that, I guess we conclude our session. So thank you all. Let's see if we have any questions from our audience. Okay, so first question is, how does an aspiring PM or PMO need to embrace or prepare themselves if they want to enter the healthcare industry? Who'd like to answer that?
I can talk about that, Asiya, and I'd love to hear some comments from my colleagues here. I think one of the things is when you go into any organization, spend a lot of time listening, spend a lot of time talking to frontline staff, talking to not only the leaders and executives, but look at the lay it on land holistically, right? Look at what is being what roles are in place, what's the priorities of that organization, and then look at how can you and your team contribute. In some cases, your team is yourself, right? You're maybe
Right.
one individual contributor, but looking at what the immediate needs of the organization are, and then also looking at where the organization is going. That's a really good way of looking at having start a PMO, or looking at a PMO that's in place and also optimizing it. And that's a great start right there. And it's much more than just projects like I mentioned earlier, right? This is just looking at what the operational priorities are, what the clinical priorities are. IT permeates almost everything, understanding that, and then connecting the dots to the services and care that's being provided to patients. And that would be a great start as to understanding what this type of PMO would be and require, right, to start off. So I'd love to hear from my colleagues on this.
Sure. Okay.
I can add a point or two, and I totally agree with Mickey. Along with understanding this, the aspiring PMOs, because I think they would like to have a quick, I would say, just take a low hanging fruit and actually develop a confidence within themselves and show the outcome. Because what really happens is the organization is already in a state of flux or anxious, and they are trying to check and actually test that how are these people going to help me. And especially when it comes to patient care, there could be a little bit of resistance related to change, etc. I always feel that the PMOs or the aspiring PMOs who want to really get into this field would like to really latch on to a few low hanging fruits. And this is exactly the way Mickey said, is by understanding the ecosystem, the lay of the land, and picking them up and show that, so that there is an inherent confidence built, and then the PMOs can actually grow uh, exponentially once that confidence get built.
Do you think the PMOs have built a certain type of framework where that sets an example for other PMOs? Vicky, have this?
Yeah, I'm trying to understand your question. I think just
Right. Have the PMOs set up any methodologies or frameworks that have proven to be successful, or?
They have, but there's not one size that fits all. And I think every organization is unique in that way. But to answer your question, there are a lot of standards out there.
Right.
And these standards include having alignment, with strategy and connecting the dots to make it operational and make things reality. And I think in patient care, you have to go the next step, right? Don't just go live with a particular endeavor. You have to look at the ecosystem for support and care and feeding of that initiative with your staff, with your team. And this is that continuing life cycle. But I think the answer to his question is yes, but there's not one size fits all. There's not one methodology that does everything, right? You have to be very flexible and very nimble with what you put together to provide that support. But again, this is just my opinion. Michael and Dr. Deepa would love to hear from you as well.
Well, I was just going to say, I was going to add a point here to this question, that I think an inspiring PM or person that wants to be in the PMO, look to your local PMI chapter and find a mentor, or look at LinkedIn and find someone a position that you might want to connect with and you could work with. That's really the best way to get it live from someone that's doing it and working with them to see if it's really, for you. And I really think that's a good way to see if that's your career trajectory or even your next career within project management or PMO. So I highly encourage that.
Yeah, yes, you're right. I mean, there's not one set but yes, we should be looking around and or reaching out to our mentors, asking for the right methodologies and frameworks. Okay, so our next question is, when implementing AI technologies in healthcare projects, what are the key considerations for PMOs to ensure ethical use, data privacy, and patient safety?
Well, I think this is one where I'm coming from at Medtronic. We take this very seriously, and this has to be a lot of homework to be done to make sure this is done correctly. And I'm sure my other panelists here can identify with this. It's difficult, but you have to have governance and process set up, and it can't be overstressed, and it takes a lot of time and effort. And I think we're going to see more and more of that, and that's going to be where a lot of effort is put into place. I know at my company, there's a lot of effort here, and just trying, we get a lot of data as our company is 100,000 employees, and I don't know how many devices we create each year, but tons and tons of data. So this is at the highest level of what we're trying to do, this ethical use of data privacy. And we all know cybersecurity is super important. We've created our own group at corporate within that. All those things are very important. So again, I think it comes back to a project manager should learn about what AI is so they can help with this. And I think that kind of goes to, what can you do now?
Okay. Mickey or Dr. Deepa, would you like to shed some light, or it's fine?
Yeah, I would like to say a word, and I totally agree with Michael. And I think the way all of these gadgets, or the way AI and chat GPT or any of the AI engines are moving ahead, like we said, and at the end or at the root of everything is about a patient. Now it's adoption by the healthcare providers. I mean, that's important, but adoption by the patient is also important, and it is here that I feel like patient education, caregiver education helps the patients and the caregivers conform to the needs of the treatment modalities. And that's also a very important part. I think there are governance and frameworks and education training methodologies that support the patient as well as their family or whoever is the caregiver in understanding the ethical requirements, what type of data is captured, and how they can actually cooperate with these technologies, so that in a way everybody benefits from it. It's not just one part benefits, but everybody benefits.
Thank you. Our third question is, should strategic PMO resources have any specific skill set to be successful?
Many.
Yeah, I can. Yeah.
Go ahead, Dr. Deepa.
Oh, I had just a thought about.
You all have something to say on this. I can just tell by looking at your faces.
I think when we look at two types of PMOs, right? One is a regular PMO, and regular PMO is all about support. Like it's basically a support in a healthcare setup. It's going to be supporting from the resources, support of extending the trainings or support with the services and whatnot. But we are looking at strategic PMOs, and strategic PMOs, the core difference between that is how they align to the strategy of the organization. The type of skill sets when you look at strategic PMOs is really going to be thought leadership, in my opinion. Like, how can you really understand the clinical requirement? And I maybe I'm because I really come from that background, having lived that physician setup. I think in that way, but really it's about finer understanding of the clinical nuance. And I always put it like there is an atom in this atom, and the structure of the atom, you have the patient in the center and all the electrons are moving about it. And that's exactly like all the health plans, the IT companies, the PMOs, everything is moving around it. But in the center you still have the patient physician DNA. So I would say that the skill sets that you still require are empathy. You require a little bit of domain knowledge. You require that understanding. And to run a strategic PMO, you require a thought leadership, but in
That's
close
true.
alignment with domain understanding.
That's true. That's very, very true.
I completely
Nikki,
completely agree with Dr. Deepa. I think the domain knowledge,
Yeah.
and not everyone is a physician. I can raise my hand to that, but having the understanding and empathy, putting yourself in the shoes of the folks that are providing care, and putting yourself in the shoes of the patients. And then the thought leadership, I think, is key, right? This is where you're not only listening, but now you're actively engaging and offering ideas and thoughts of how to accelerate, how to embrace, how to support the different types of patient care that you provide. And I think that leader needs to also be very flexible, right? Not being rigid and stuck to one type or one way of working, but being very open to different types of ideas and different types of ways of implementation, and and also not just focusing on projects. I focusing on the bigger picture. And in fact, many, if not everything, is not a project in a healthcare setting. And how do we support operational and clinical initiatives at the same time? And this is where you're thinking outside of project management. You're thinking much broader than that. And then focusing on benefits, I think we mentioned this throughout, right? Benefits and the value that you would provide and your team would provide. That is really, really key.
Yeah.
And I would add, I agree with Dr. Deepa and Mickey. I would add a tactical piece, because it's something I'm working on right now, is to be strategic and to really be successful, you need to understand what you're doing. So OKRs, objectives and key results, and having that up to the highest level of strategy and coming all the way down and making sure everyone understands it and reviewing it quarterly. Very tactical, but I think that really creates good success. And so organizations, at least in my organization, that's very important. I think that drives the PMO's success by having those in place and having the right things in place. So I think that's really important. So if you don't know what OKRs are, Google it. I think it's a really useful way of collecting data and showing success.
An excellent way of enabling and alignment. We use that in our organizations as well, Michael. So that's a really, really good point. I think one of the things about OKRs is you got to get tie it all the way to the top, like you mentioned, right? Tie it to our executive leadership, and then it spreads out and cascades throughout the organization.
And honestly, that's a great point. I think AI could help with this, right? So soon AI is going to be able to take all these things and really line them up and give them information live. So I think that's another application for AI.
And I also think that there is a good traceability, just like we talk about the requirement traceability matrices and multiple things. There is a traceability of a plan or an activity proposed to right till the top where there has been a thought or where there is a plan or an objective. So OKR is a fantastic model or a framework for.
That's great. Okay, so we have time for 2 more questions. So our next question is, considering the rapid advancements in generative AI and ChatGPT technologies, what are some of the, I think this person has not completed the question, maybe. I think the question isn't complete. So I'll just take another question. How can strategic PMOs contribute to driving innovation in the healthcare industry? I guess we've already answered that, haven't we?
I think we did. Having a means of prioritization and intake. And also, I mean, there's formal things like, investment planning, strategic planning on an annual basis. But I think there's also lots of room. In fact, in my opinion, it's a requirement that your healthcare PMO has room for innovation, has room to conduct experiments and pilots. And I don't mean to conduct experiments on patients. I'm talking about testing out and piloting new ideas to see if they're successful in a limited, smaller scale. And that's where a lot of innovation can happen. And having, very lightweight governance and empowering these multidisciplinary teams to go forth and try their new ideas and try their new processes or new technology, let's say. And so innovation can be a planned event, very lightweight, but it can be planned. And that's where I think a healthcare PMO can shine, right? Not just focus on annual planning.
I think taking that a step further, that's a great response. Innovation in a PMO and just innovation in general. Medtronic's a very technology-based company and innovative. We started an ePMO, and we did something that I thought was innovative. We took an office space and we painted it in what's called fuzz paint, which is white paint you can write on. And we had 10-foot ceilings. We had all 4 walls filled with all our information instead of PowerPoint.
That's creative.
Yeah, we used that area and we brought in leaders and we walked them through our plan and we could change it. And I mean, it's a small thing, but it was innovative. And we really stressed to do things much more innovative and don't do it the same as we've done before.
Yeah.
Figure out innovative ways, but you have to push that and you have to give people that runway and you have to talk about it all the time because people will fall back into their silo and their filters. And it's a hard thing to do, right? I work closely with 3M, which is just down the road from us. And we always talk about innovation. It's a very difficult thing. So it's not easy, but I think you need to stress that with your teams, and innovation should be everywhere from A to Z. So just my little soapbox.
I agree with Michael, and just like he said, innovation should start at a grassroots level. I remember we were creating a process for patient care continuum, where we were actually taking care of juvenile diabetic patients. So people, small children who are diagnosed with diabetes, and they have a bigger lifespan, and then how do we take care of them? So actually, we had brought in all the patients together and their caregivers in a meeting, and we were trying to ask them all possible ways in which they would like to be taken care of. So it's not about just some healthcare professional sitting in one place, but actually I remember about more than 20 patients were there and their caregivers. You won't believe the type of energy that was there and the type of innovational, I would say, ideas that came up that would never exist in any textbook. I would say that the way that even children contributed, even small things, and I would say the innovation in healthcare is all about how do we all maintain our own health and the public health important. It's not just your own health, but the
True.
people surrounding you also should be healthy for you to be healthy. So
Right. Makes a difference. Yeah.
That's the difference. So I think it's
Yes.
all more about a community health, I would say population health. And that actually stems the concept of population health, which really PMOs can help so efficiently. And innovation can be right from one small process of the patient to a giant PMO or, even a countrywide initiative.
That's true. Michael, I liked your idea. I think I'm going to, share it with our organization to see if they can implement it, because we're still doing it the traditional way.
I think it's just, again, just what we're talking about. It spawned that innovation, and people walked in there, leaders, and they're like, wow, this is odd, and that we could point and change and move things, right, versus the old way of doing things. So it was just, it was something innovative, and people are still using it. I'm not in that office space anymore, but it was pretty interesting.
Good. Well, I guess with this we conclude our session. I personally believe, this was a very insightful discussion. I personally enjoyed it. I personally enjoyed listening to all of you and your experiences. We do look forward to hearing from our audience how they felt. So I guess till next time.
All right.
Thank you so much. Thank you so much, everyone. Thank you, Asiya, for having us.
Yes.
Thank you so much, Asiya, Priyanka, Gaurav. Thank you so much.
Thank you.
Thank you,
You're
Mickey.
most welcome.
Thank you.
Yeah.